The first fundamental position is standing position. During standing, the whole body is supported by a smaller base. Because of this, standing position is most difficult to adopt for a longer period. There are a lot of coordinated muscle activity to maintain this posture. In this position, the head, neck, shoulder, hip, knees, and ankles are at neutral position. Legs slightly apart and hands at the side of the body. The effects on users of this position is, this position is not stable due to a small base and the distance between the center of gravity and the base is long. This position is used as a starting position for some freestanding exercises. One of the derived positions of standing is wing standing. In this position, the shoulder is abducted, elbow is flexed, while hands resting on the hip. The head, neck, hip, knee and ankle are in neutral position. The effects and uses of this position are, it is used to perform trunk bending exercises, neck exercises, and breathing exercises. So, another derived position from standing is yard standing. In this position, the shoulder is abducted, elbow and wrist are in neutral position. Head, neck, hip, knees and ankles are in neutral position too, while the legs are slightly apart. The effects and uses of this position is to perform trunk rotation and bending exercises, jumping jack, and to perform wrist, elbow and finger exercises.
Lying is the easiest and most stable position as it has a large base of support and low center of gravity. The body can be completely supported in supine position with the arms side by side of the body and legs are kept straight. This position can be maintained for a longer period than any other starting position. With this position, the muscles are relaxed. There is actually no real muscles responsible for maintaining this position. This position is normally used for weak patients or children. Lying is suitable for many exercises such as upper limb, lower limb, trunk, neck exercises like strengthening, stretching, aerobic and anaerobic, and breathing exercise. This position is also frequently used for soft tissue manipulation. Some of the derived positions of lying are side lying. Lying on the side of the body. The upper extremity is flexed and kept under the head. A pillow can be used in between the hand and the head for comfort. Lower limb slightly bent. It requires 3 pillows, one for the head, one for uppermost arm, and one is for legs which are bent. This position is the most inconvenient to maintain for a longer period, as the upper extremity, which is placed under the body, will be more painful and positioning the lower limb also very much difficult. This position is normally used for side lying leg lift, lateral rotation, and posterior drainage. Crook lying. From lying, the hip and knees are flexed so that the feet face forward and rest on the floor. With your knees bent, your spine tends to flex. Very little muscle work is required. Tension is removed from the structure anterior to the hip joint so that the pelvic rolls backward and the lumbar spine is straightened out and relaxed. This position is used for reducing symptoms of these problems. train relaxation and posture, and in pelvic and back exercises. This position is normally used for sit-up, pelvic raise, and relaxation.
Kneeling is like the fundamental position of the standing, but weight is transmitted through the knee joint due to the right angle alignment of the knee to the body. The lower leg rests on the floor with the feet plantar flexors. It is very much difficult to position to maintain for longer period. The kneeling position is used as a study position for backward movement. It also can be used to perform math activity, coordination, and balancing exercise. One of the derived positions of the kneeling position is half kneeling. In this position, one knee supports most of the weight and another leg is bent to right angle at hip, knee, and ankle. This position can be used to squat, hip flexor muscle stretcher, and half kneeling chop. Another derived position of the kneeling position is prone kneeling. In this position, the trunk is horizontal, supported under the shoulder by the arm, and at the pelvis by the thigh, which must be held vertical. The head is held in line with the trunk. This position is used for kneeling Superman exercise. It also provides a study position for push-out exercise.
Sitting is a rest position supported in humans by the buttocks or thighs, where the torso is more or less upright. The body rests mainly on the tuberosities of the ischium. The hips and knees are flexed so that the back of the thighs are supported. The knees should be slightly apart so that the position of the legs is easy. The ankle is in a neutral position so that the feet rest comfortably on the floor. The hip, knee, and ankle joints should all form right angles. The upper body is mostly in a neutral position, with the trunk straight and upright, the shoulders relaxed and neutral, and the head and neck in neutral position. The working muscles for maintaining the position are mainly the neck, back, and posterior shoulder muscles. The weight should be evenly distributed on both buttocks. Effects and uses of the sitting position. The sitting position provides better stability than standing due to its larger base of support and lower center of gravity. The pelvis is also firmer because it is supported by a surface. Additionally, there is very little work in the leg muscles. One of the derived positions of sitting is long sitting. In this position, the patient sits with legs fully extended and supported for the whole of their length. The hip joint is flexed so that the trunk and thighs form a right angle. Effects and uses of long sitting. This position stretches the hamstring muscles. Also, it is used for treatment of spine lordosis. This is because the pelvic tilt is diminished by stretching the muscles above the pelvis. This straightens out the lumbar spine and stretches the ligaments and muscles in the back. Lastly, it should be avoided for patients with heart or respiratory conditions, as compression of the abdomen can impede respiration. Another derived position is high sitting. In this position, the patient sits on a high plinth or table, and the feet remain unsupported. Effects and uses of high sitting. In this position, the unsupported legs allow for open kinematic chain exercises. For example, leg extensions and testing for knee reflex. In the hanging position, The body is suspended by grasping on a horizontal bar. The arms are extended and apart at shoulder width with the forearms pronated. The legs and trunk are straight with the heels together and feet plantar flexed. Effects and uses. Hanging is suitable for athletic people with good muscle strength. This position passively stretches the spine and its ligaments, particularly the lower part. Thus, it is used in treating spinal curvatures. Also, it stretches the shoulder muscles and ribs. Thus, it is used for treatment of flat chest. The derived position of hanging is half hanging. Here, the body is supported in the oblique position by the arms, which are grasping a horizontal bar. The rest of the body is inclined and straight. Effects and uses. This position requires strong muscle work for the back muscles, especially the scapular retractors, which work against gravity to support the body weight. It can also be used for hanging knee exercise.